Check, hey, check one, check. Check, hey, check. Check, hey, check. Check, hey, check one, check, check one, check two, check, hey. ఈ చైర్ బ్యాక్గ్రౌండ్ ప్రొజెక్టర్ మీద ఈ చైర్ బ్యాక్గ్రౌండ్ ప్రొజెక్టర్ మీద
ఆడియో ఆటలు వేస్తే వస్తుంది ఆడియో ఎంత మాట్లాడినా కూడా ఆటలు మనం చేసినా కంట్రోల్ చేసుకోవాలి ధ్యానం వేస్తే మనం తగ్గించుకోవాలి. ఎవరో వస్తారు ఎవరో ఉంటుంది మీడియా వాళ్ళు తీసుకోవడానికి రెడీ చెట్టు పెడతారు దానికి మరి అక్కడ ఆక్స్ అవుట్ లేదు లేదా వచ్చి అడిగి గైడ్ వస్తే
check, check. Check one, check. Check one, check two. Hey, hey, hey. Check one, check. Check one, check two. Hey, hey, hey. Check one, check two. Voice clear ఉందా? Huh? ఎక్కడ తీసుకుంటారు ఎక్కడ కెమెరా
అప్పుడు తగ్గించారు లెవెల్ తగ్గించారు
జాబ్ సరిపోవడం లేదా? అయ్యో
రెండు మూడు కల్లా రాని అంతే తక్కువ తగ్గేసి వెళ్తాడు చిన్నదారి కాబట్టి మొత్తం ఆడియో చెక్కింగ్ ఇలా కూడా చేయించకపోతే టైం మారిస్తే నాకు ఇక్కడ తెలుస్తుంది ఆడియో అంటే
check, 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 test one, check. Check one, test, check.
చెక్ చెక్ వస్తుందన్నా చెక్ 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 Check one, check, check, check. Test one, check, check one, test.
చాలా that's what I'm telling you. Last time also he made me fall down. I think better. We only stop. The chairs. Usman. Chairs बीच में से था ना. And उस्मान जी जरा यहाँ वाला भी लाइट ऑफ करना. Remove that chair. Only start with the session. That's what we didn't follow. Oh, Shaz. And you close the door. Door close. Good morning, everybody. Good morning to all the delegates and the dignitaries, and to all my faculty and colleagues. And I wish a warm welcome to Dr. Ramesh Reddy Garu, DME, and also I welcome Dr. Ramurthy Garu to this session. Myself, I am Dr. Padmaja, working as an associate professor in Department of Microbiology. Today my topic is on hand hygiene. One of the most common mode of transmission of pathogens is via the hands of healthcare workers. This leads to healthcare associated infections and also even to the spread of antimicrobial resistance. So a simple basic measure and a simple cost effective task is to follow hand hygiene practices to prevent these healthcare associated infections. Ignaz Semmelweis was the first scientist who introduced antiseptic agent for hand hygiene. He was the first scientist who insisted all the clinicians and the residents to wash their hands in between the patient contacts to avoid the transfer of cadaverous particles from one patient to another patient. But today, despite the advances in hospital infection control, translating Semmelweis' theory into practice still remains a challenge. Hand hygiene is a general term applied to hand washing, antiseptic hand wash, antiseptic hand rub, surgical hand hygiene, or antisepsis. Hand washing can be done either by using soap and water, and antiseptic hand wash is done by using detergents containing an antiseptic agent, for example 4% chlorhexidine gluconate, or it can be 7.5% povidone iodine. Antiseptic hand rubs used or commonly, every antiseptic hand rub should be associated with an alcohol containing a scrubbing agent. So 0.5% chlorhexidine gluconate in 70% ethyl alcohol and 60 to 70% of ethanol in gel form, or N-propanol with mesotronium sulfate can also be used as antiseptic hand rubs. Hand washing or using an alcohol-based hand rub before operations by surgical personnel is also recommended. Human skin is an inhospitable environment to have many flora. There are two types of human skin flora. One is transient flora, other is resident flora. Transient flora colonizes the superficial layers of the skin. They are acquired by direct contact with the patients or by touching the contaminated surfaces, most frequently associated with healthcare associated infections, and they are easily removed by hand wash. whereas resident flora are present in the deeper layers of the skin, for example, coagulase negative staphylococci and diphtheroids. They cause contamination of the sterile body cavities or non-intact skin, less frequently associated with healthcare associated infections, and they are more easily removable, they are more resistant to removed by hand washing. There are 5 stages of hand transmission. Germs present on the patient's skin and immediate environment surfaces in the first stage. Second stage, germs transfer onto the healthcare worker's hands. Third, germs survive on the hands for several minutes. Fourth, suboptimal hand cleansing results in hands remaining contaminated. And the fifth stage is contaminated hands transmit germs via direct contact with the patient or patient's environment. Many of the healthcare workers perceive that the hand hygiene practices are at high level, but still the compliance is less than 50% in the healthcare institutes. The reasons for insufficient compliance are insufficient facilities, lack of training and information, lack of time, lack of equipment or supplies, high patient care load, cutaneous intolerance to these disinfectants. The basic indications for hand hygiene are when hands are visibly soiled, dirty, contaminated, when they are exposed to spore-forming organisms such as Clostridium difficile or Bacillus anthracis, washing with soap and water is recommended. If hands are not visibly soiled, use an alcohol-based hand rub for routinely decontaminating the hands. When should you wash your hands with soap and water? Wash your hands with soap and water, with plain soap and water, or with an antimicrobial soap when your hands are visibly soiled, when they are visibly contaminated with blood or body fluids, before eating and after using the restroom. When should you use an alcohol-based hand rubs? If hands are not visibly soiled, please use alcohol-based hand rubs before having direct contact with the patients, after having direct contact with the patients, after coming in contact with the body fluids, after touching the equipment or furniture surrounding the patient, and after removing the gloves. These are the differences between soap and water and alcohol-based hand rubs. As an overall, I provided all the salient features. The duration of washing soap and water is at least 60 seconds we need to wash our hands, whereas alcohol-based hand rubs, 20 to 30 seconds we need to wash our hands with the alcohol-based hand rubs. What are the advantages of cleaning hands with alcohol-based hand rubs? They take less time to use, at least 15 to 20 seconds, more accessible than sinks at the point of care. They cause less skin irritation and dryness, more effective in reducing the number of bacteria on the hands, has led to improved hand hygiene practices, and it has broadest antimicrobial spectrum. This is a picture showing how the hands are before hand hygiene and after hand hygiene. The colonies are studied on the culture plate. If the finger imprints of the hand are taken, after incubation, the colonies are grown on the culture plate. After hand hygiene performance, there is no colony on the culture plate. So contaminated healthcare workers' hands should always be screened for these kind of practices. Specific indications for hand hygiene: before patient contact, before donning gloves, when inserting a central venous catheter, before inserting an urinary catheters, peripheral vascular catheters, or other invasive devices that don't require surgery. After contact with the patient's skin, you need to perform hand hygiene, contact with body fluids or excretions, non-intact skin, wound dressings, and after removing the gloves. These are the 5 moments of hand hygiene as recommended by World Health Organization guidelines: before touching a patient, after touching a patient, before any performing clean aseptic procedures, and after contact with the patient surroundings, and after exposure to body fluids, hand hygiene practices should be performed. These are the various examples that have been represented before and after touching the patients. Courtesy gestures like when you shake your hands, or when you stroke your arms, or during clinical examination like while checking pulse, blood pressure, while you auscultate and palpate the patient's abdominal palpation, physiotherapy, and when you come in direct contact like helping patient to move around, applying oxygen mask, to get washed, recording ECG, etc. These are all the various examples where you need to practice hand hygiene practices before and after touching the patient. And before and after body fluid exposure, like whenever you come in contact with mucous membranes, like aspiration of secretions, giving an injection, instilling eye drops, handling invasive devices like catheters, central lines, ET tubes, or bandages or napkins, and when you come in contact with even non-intact skin while giving care for skin lesions and wound dressing, these hand hygiene practices should be followed. After touching patient surroundings, also we need to we need to follow hand hygiene practices, like whenever we touch patient's case sheet or a bed rail of a patient's bed, or it is a Euro bag, or it is a medical equipment, or it can be a bed linen, or it may be any patient's personal belongings nearby, should be hand hygiene practices should be followed. When healthcare workers' hands get contaminated, whenever you touch infected sites, draining wounds, patient skin, there will be heavier hand contamination even when there is a direct patient contact, or when there is a contact with body fluids, when a diaper change is done, respiratory care is given, or when with dermatitis or skin lesions, healthcare work hands gets contaminated. Why cleaning is important between patients? Because to prevent cross transmission of pathogens from one patient to another, from patients to healthcare workers, and from healthcare workers to patients. What are the other activities leading to hand contamination? Majority of the healthcare workers contaminate their hands by touching the environmental surfaces near the affected patients. Especially if you see the graph, bed linen is the majority of the environmental surface that has been giving contamination when you touch the immediate proximity of the patient, whatever the surfaces are there, you need to wash your hand, you need to follow hand hygiene practices. The inanimate environment can facilitate transmission. This is a picture showing the inanimate surfaces where all the fluorescent marking have been isolated in one of the study with vancomycin resistant enterococci. So cleaning the environmental surroundings is very important to avoid all these multi-drug resistant organisms. What are the other policies related to hand hygiene? Fingernails, subungual areas harbor high concentrations of bacteria. Natural nail tips should be kept to ½ inch in length. Artificial nails should not be worn when having direct contact with the high-risk patients, especially in ICUs. And cheap nail polish supports the growth of large number of microbes. Wearing artificial nails may contribute to transmission of Pseudomonas aeruginosa, a gram-negative bacteria, outbreak in a NICU. And even skin underneath the rings get more colonized, so avoid jewelry during this process of giving care to the patients. Gloving policy. Wearing gloves does not substitute hand hygiene. Hand decontamination should always be done before wearing gloves and after removal of gloves, as gloves may have invisible defects which may allow the transmission of microorganisms. This is a picture showing the efficacy of hand hygiene preparations in killing bacteria. When we observe plain soap is good, antimicrobial soap is better, the best is alcohol-based hand rubs. Selecting hand hygiene products depends on the antimicrobial profile, user acceptance, and cost of the product. Preparations used for hand hygiene. There are various preparations used for hand hygiene, like plain non-antimicrobial soap and an antimicrobial soap with many compounds of alcohols, chlorhexidine, hexachlorophane, iodine and iodophos, and triclosan gel. This is the chart showing the activity of alcohols and antimicrobial compounds, where we can observe alcohols as excellent activity over all the pathogens over gram-negative and also gram-positive, including mycobacteria. But there are certain compounds like chlorhexidine, where you can see mycobacteria has less activity with these compounds. Chlorhexidine, where there is a single plus. In this part, we can observe here the activity is very less over mycobacteria with the usage of chlorhexidine compounds and iodophore compounds and phenol derivatives. Hand hygiene products. Alcohol-based hand rubs are available with various names. Microshield, chlorhexidine and alcohol skin antiseptic is present. Gel is triclosan plus ethyl alcohol combination. Sterilium is a combination of propanol with mesotronium sulfate. And all these non-alcohol based products are medicated soaps. 4% chlorhexidine gluconate and 7.5% povidone iodine are used as hand hygiene products in all healthcare facilities. This is a surgical hand pre-wash where we need to use non-alcohol based detergents like Lifebuoy soaps before performing the hand pre-wash should be done with this non-alcohol based